Congratulations on the purchase of the ClearSense accessory handpiece. ClearSense is a real-time temperature sensing accessory device for use with your Joule laser. It delivers safe and effective treatments for a variety of conditions when temperature sensing is needed, such as nail and skin rejuvenation. When your ClearSense accessory arrives, your Cyton representative will unpack it and install the needed software. The purpose of this ClearSense video is to prepare clinicians to be able to set up the accessory, to utilize safe start treatment protocols, and to appropriately prep their patient for treatment. This video will also show ClearSense treatment techniques. This video segment will describe and demonstrate the system setup for the ClearSense accessory. This is the ClearSense handpiece with integrated temperature sensing. It has an audible tone that alerts the clinician when the recommended treatment temperature range has been reached. It has a large 6mm spot size, and it has a temperature indicator with 3 different colored light ranges that display either when treatment temperature is too low, when safe endpoints have been reached, or alerts the clinician to temperatures that are outside of the recommended range. Prior to treatment, connect the ClearSense handpiece to the laser arm. Locate the red dot on the connector cable and attach to the red dot on the ClearSense handpiece. The operator manual is a great resource to learn more about how the system works. Please refer to the manual for treatment considerations with the ClearSense accessory. Also found in the operator manual is the Safe Start protocol. The protocol is a starting point for treatment. Please refer to this prior to use. When treating onychomycosis, which is a fungal nail infection, it is recommended to get a KOH or PAS along with a mycologic culture on each patient. These tests show if fungus is present. Many diseases look like onychomycosis, but are not. Studies indicate that well-trained physicians are right only 50% of the time when identifying a fungal infection. The only reliable diagnostic is a mycologic culture. This segment of the video reviews how the ClearSense handpiece is utilized in the ClearToe application. ClearToe is the treatment of nail fungus with laser energy to heat the nail and nail bed, resulting in a decrease in nail fungus, leading to an increase in the growth of clear, healthy nails. The use of the ClearSense handpiece with the ClearToe application provides real-time temperature sensing capability. The clinician will know when they have reached the optimal treatment temperature range when the handpiece emits an audible tone and when the first 2 yellow temperature indicator lights are illuminated. Both of these capabilities maximize treatment efficacy, comfort, and safety. A typical treatment time for all 10 toes can be completed in 10 to 20 minutes. Prior to treatment, use a low lint or lint-free alcohol wipe to clean the temperature sensor window. This will maximize the sensor's visibility and provide a more accurate temperature measurement. As seen on the handpiece, there are 2 displays of indicator lights showing a range of temperatures. The temperature sensor reads the temperature within the treatment area. It ranges from 32 to 48 degrees centigrade. Specifically, the green lights range from 32 to 38 degrees centigrade, the yellow lights from 40 to 44 degrees centigrade, and the red from 46 to 48 degrees. The handpiece emits an audible tone starting at the yellow temperature sensing light and increases in frequency at each additional light. To properly use the temperature sensor, make sure to triangulate the laser aiming beam and temperature sensing beam. When at the ideal spot, both beams form a single red dot. To differentiate between the 2 beams, the temperature sensing beam flashes, while the laser aiming beam is a solid red beam. This is the incorrect way to measure the temperature. Notice the flashing temperature sensing beam to the right, while the laser aiming beam is on the left. To get the accurate temperature reading, align the two beams together at the right distance to create the triangulated beam, thus getting the true and accurate temperature reading. You will not be measuring the temperature properly if these beams are not aligned. The recommended treatment temperature range when using the ClearSense handpiece with the Clear Toe application is 40 to 42 degrees centigrade, or when the first two yellow lights illuminate on the temperature indicator. Stop the treatment if the patient is reporting that the heat to the area being treated is too hot, or if the red lights are activated on the temperature indicator. The patient should feel a moderate degree of heat to the area being treated, but it should not be painful. This is the same treatment video shown with an infrared camera. This IR video shows the thermal effect taking place. Take into account the overlap needed to treat the entire nail plate. The temperature bar graph depicts how much heat the treatment area receives. Next, let's review patient preparation. Make certain to place a white towel under the patient's foot or hand, creating a safe laser environment. The patient may lie down on the treatment table or sit up in a treatment chair. For the most effective treatment, ask the patient prior to the appointment to clip and debride toenails. For a safe and effective treatment, make sure there is no nail polish on or around the treatment area. Before treating, wipe clean with an alcohol swab to get rid of any dirt or debris. Also, make sure to take baseline photographs of the nails before treating to help document nail growth for follow-up appointments. Then take photos at each follow-up appointment, marking progress. The patient and clinician must wear appropriate laser safety eyewear during the treatment. Make certain that the glasses are labeled effective for 1064 nanometer use. Next, we'll review treatment techniques. The ClearSense handpiece with its optimal 6mm spot size covers a large area and has an ergonomic design, making procedures easy to perform. To begin, follow the application screens on your Cyton laser system. In the main menu, tap the Arm button. Choose ClearScan YAG. Then tap the ClearSense Soft Key button. Once in the ClearSense treatment application screen, tap the Clear Toe button. Refer to the operator manual for the Safe Start protocol. When the system is in the ready mode, begin lasing below the cuticle on the skin in a circular or grid pattern. Taking into account the size of the 6mm spot, the size of a pencil eraser, continuously move within the nail bed in a circular or grid pattern, making sure to cover the entire surface evenly. Continue this motion until the ideal temperature of 40 to 42 degrees centigrade is reached, or until the yellow lights illuminate and you hear an audible tone on the ClearSense handpiece. Always consider patient feedback. There should be no pain involved with this treatment. Depending on the condition of the infected nail, the patient may or may not feel heat. When you've completed one toe, continue on to the next toe. Treat all 10 toes even if only one nail is infected, as it is possible that infection can be underlying in all toes. After treating all toes, repeat the same steps for a second pass of laser energy. Treatment times will range from 10 to 20 minutes. The recommended treatment protocol is 2 to 4 treatments, 2 to 4 weeks apart. Patients can resume normal activity immediately after treatment with no downtime. It may take 3 to 6 months to see clear, healthy nails depending on the speed of the patient's nail growth. ClearSense therapy has brought tremendous patient satisfaction to those who have suffered hopelessly from this condition. Enjoy the benefits, both professionally and financially, by offering an efficacious clinical solution meeting market demands for this popular procedure while maximizing and protecting your investment with the best business model with your Cyton ClearSense technology.